Hi, my name is Riley. I'm going to be your nurse today. I'm performing a head, ears, eyes, nose, and throat assessment on you. Can I get your full name and date of birth, please?
My name is Simon Glenn Smith. I was born August 7th, 2002.
I'll check your wristband to double check. It's correct. And before entering the room, I performed hand hygiene and closed the curtain for privacy. Do you have any allergies?
Nope.
Any religious or cultural preferences you'd like me to know about?
No.
Okay. And how are you feeling today?
I'm feeling good.
And in any pain?
Nope.
Okay. And upon inspecting the client, his skin tone is even and appropriate for his ethnicity. His affect and mood are appropriate, as well as his behavior. His body positions are erect. His body movements, I don't know any involuntary movements, and they're all smooth. His respiratory effort, I don't see any accessory muscles being used, and the rate and depth are normal. And for his distress, I don't note that he is in any. And then for his general appearance, he seems to have good hygiene, is well groomed, and is dressed appropriate for the weather. And I don't know any odor or any mobility aids. And I'm going to move on to your head and neck. Do you have any headaches?
No.
Any past injury to your head or neck?
Nope.
Is there any pain with movement of it?
No.
Okay. And I'm going to inspect it for any lesions or masses, and I don't know any. Your trachea appears midline. I'm going to palpate it for any shifting, and I don't know any. And I'm going to palpate your neck and your head for any masses. Any pain with that?
No.
Okay. His the contour is good. I don't know any masses or lesions. And now I'm going to palpate your hair to look for any masses or lesions. I don't know any. There's no parasites. It's evenly distributed. He has a large quantity. His hair color is brown and it feels smooth. And I'm going to palpate your carotid arteries. I'm not going to press too hard to block off blood flow. There are 3 and they are pulsing equally bilaterally. And I'm going to palpate your lymph nodes, and I'm going to use the pads of my fingers and go in a circular motion. So your preocular, postocular, occipital, submandible, submental, submandibular, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Any pain with that?
No.
They're all soft and movable, and I don't know any hard lymph nodes. And now I'm going to move on to your eyes. Do you wear any glasses or contacts?
No.
Any recent vision loss?
No.
Do you see any floaters or have any blind spots?
No.
Okay. And I'm going to inspect your eyelids, your eyelashes, and your eyebrows. The hair is distributed evenly. The eyebrows are symmetrical. The eyes are in line with each other. No lesions or masses noticed. And now I'm going to look at your corneas. They are clear. Your sclera is white, free of jaundice and erythema. I'm going to pull down and inspect your conjunctiva. Can you look up? Okay. No erythema, swelling, or jaundice, or drainage noted. And now I'm going to move on to your ears. Do you have any hearing aids that you use?
Nope.
Any recent hearing loss?
Nope.
Any ringing in your ears?
Nope.
Okay. There's no drainage noted. Is there any pain either?
Nope.
Okay, I'm going to palpate your pinna. Any pain with that?
No.
Your tragus?
No.
And then your mastoid process?
No.
Good. And now I'm going to move on to your nose. Do you have any trouble smelling?
No.
Do allergies affect your smelling?
No.
Any history of nosebleeds?
No.
Okay. Upon inspection, there's no masses or lesions noted. Can you look up? The septum appears midline and is not deviated. The terminates are symmetrical and no enlargement is noted. And now I'm going to look inside the nose. Can you look up? Membranes are pink and moist. Cilia is evenly distributed. And there's no drainage noted. Okay. And now I'm going to move on to your mouth and throat. Do you have any trouble smelling? I'm not smelling. Tasting?
No.
Any trouble swallowing?
No.
Any mouth sores or bleeding gums?
No.
Okay. And I'm going to inspect the outer lips. They are moist. There's no lesions or masses noted. There's no lip drooping or lip lag. And everything appears symmetrical on the face. And now can you open up? Teeth are all there and intact. The gingiva is pink and moist. Can you stick your tongue out? There's no lesions or ulcers in the oral cavity. The palates are evenly pink and they look firm. Okay, you can close your mouth. Okay. And overall the head appears normal cephalic and is atraumatic. Everything is symmetrical on the face. And I'm going to test your cranial nerves. So for cranial nerve number 1, I'm going to test your smell. So I'm going to have you plug one nostril and close your eyes. And then I'm going to bring this scent under it and I'll have you tell me what it is.
Peppermint.
Yep. And can you inhale and exhale out of that nostril? Any trouble with that?
No.
Okay, and then we'll test the same thing on the next nostril. Can you tell me the scent?
Lavender, like thieves oil.
Yep. Can you inhale and exhale out of that one too? Any trouble with that?
No.
Okay, so nostrils are patent and cranial nerve number 1 is intact as he's able to smell. And for cranial number 2, I'm going to test your visual acuity. I'll have you read this sentence for me.
It is snowing a lot outside today.
Good. Client can read 12-point font from 14 inches, so cranial nerve number 2 is intact. And cranial nerves 3, 4, and 6 all go together. So first, I'm going to have you stare at my finger, and I'm going to move it in the 6 cardinal gazes. And I'll have you follow it without moving your head. Good. No nystagmus or extraocular movements are noticed with that. And I'm going to have you stare at my forehead, and I'm going to bring a pen light in from the side, and I'm going to look for your pupils to constrict equally on both sides. Good. Okay, now the other side. Good. Pupils both constricted, and they are about a size of a 3, which is within normal range. They're supposed to be a 3 to 5. And then can you stare at the wall over there? And then stare at my finger. Good. Pupils dilated when looking at a close object or a far object, and then constricted looking at a close one. And now I'm going to have you stare at my finger. I'm going to bring it into your nose and follow it. Good. Eyes converged. So pupils are equal, round, reactive to light and accommodation, and they are a size of 3. And for cranial nerve number 5, I'm going to test your light and sharp touch. So I'm going to have you close your eyes and tell me if you feel light or sharp.
Sharp. Sharp. Light. Light. Sharp. Sharp.
Good. Client can feel equally on both sides of his face. Cranial nerve number 5 is intact. And for cranial nerve number 7, I'm going to have you make a series of facial movements. So can you puff up your cheeks? And no air is supposed to come out when I press on them. Good. Can you smile now? Frown. Raise your eyebrows. Good. Movements are smooth and no involuntary movements are noted. So cranial nerve number 7 is intact. And for cranial nerve number 8, I'm going to do a whisper test. So can you plug one ear? And I'm going to whisper a 2 to 3 syllable word in his other ear, and he'll repeat it back. Basketball.
Basketball.
Yep. Okay. Now other ear.
Trampoline.
Good. Client could hear both words on each side of his, both ears. So cranial nerve number 8 is intact. And cranial nerves 9 and 10 go together. So for this one, can you first swallow for me? Any trouble with that?
No.
Good. And now I'm gonna have you open your mouth. I'm gonna depress your tongue. And how you say ah? Okay. I was looking for the uvula and palates to rise midline, and they both did. And so cranial nerves 9 and 10 are intact. And for cranial nerve 11, I'm gonna have you shrug your shoulders. Any pain with that?
No.
Okay, can you turn your head against my resistance? Any pain?
No.
Okay, other side. Any pain?
No.
Good. Client has a range of motion of 5, and cranial nerve number 11 is intact. And now for cranial nerve 12, I'm just going to stick out your tongue and I'll inspect it. Tongue is symmetrical, no atrophies noticed or tremors, or no lesions on the tongue. So cranial nerve number 12 is intact. And that concludes my assessment.